When I saw my patient in clinic that was in respiratory distress, her physical appearance was very striking. She had difficulty even walking to the exam room because she was getting short of breath. She had some weight loss. She was breathing so fast that she couldn't carry on a conversation and barely answer one-word questions.
We tend to get the sicker children, and many times when a child is ill, there's a lot of times we don't know what the source of that is.
When these healthy teenagers were coming in when it's great weather, no previous pulmonary history, and they're in severe respiratory distress requiring oxygen or a ventilator, we had to dig deeper.
Her mom mentioned it on the way out to the ambulance, to my nurse, that she had been vaping. And I knew, and when I heard that part of the story, I knew it was very unfortunate that she was vaping and was very sick with an illness, that for sure would not help. But we didn't make all those connections until later.
We were doing bronchoscopies of all of these kids because that's very typical when you don't know what the lung pathology is, because we want to get a sample. You want to rule out unusual infections or any other possible diseases.
When the ambulance came and took her to Children's, and I called the hospital to give them a heads up, I more just told them that she was in respiratory distress, had a diagnosis of pneumonia, was on antibiotics, but was clearly not getting better.
It was very shocking and scary because these kids should be healthy. They should be enjoying their summer. But instead they're in a hospital bed on oxygen or on a ventilator. And these are athletes too, really strong teenagers.
We have a 14-year-old with, and then it was, well, now I've got a 15-year-old with, and the attending at the time, she went, well, aren't you talking about the last kid? And he was like, oh no, and I got another one yet too.
In teens, what are some things that they do? There are some risk-taking behaviors, and so we asked about any substance abuse, travel, of course, but the one thing that sort of tied them all together was that they had been vaping.
And that's how it all got pieced together, is that was a common thread with all of the initial presentations, is each one of them had been vaping at some point in time, and vaping right up to the point that they got sick and showed up in the hospital.
And then on July 25th, there were already 8 teenagers who were admitted with lung injury. And at that point, the Department of Health Services then issued an alert to the entire state, letting them know if there are cases similar to what we were seeing, to let the proper authorities know and to keep track of it.
So Dr. Goodsight worked with the state, and we came out with our statement. At the same time, the state put out its advisory. That was taken national, and then there was an absolute flood that happened after that of similar cases of a much larger age group.
After that, I think it just spread like wildfire. Other cases were reported in other states, and then there was the first death sometime in early August.
We never imagined, at least I never imagined, that you would see the national and international, the number of phone calls that members of the team took over the first couple of weeks about what were we treating, what were we seeing, how was this working.
We thought we were getting rid of cigarettes. We thought our children were protected. And vaping, or e-cigarettes, is now sadly considered and looked at as the new return of the cigarette.
And I think we have to keep it in people's minds. This isn't something that went away. Kids are still out there vaping.
It was sad, overwhelming, but at the same time, it opened everyone's eyes.
Nicotine is 10 times stronger. There's 10 times more nicotine in an e-cig than in a normal cigarette.
One promising thing about humanity is that most want to protect our kids. Most want the best for our kids.
Vaping is powerful. It's a powerful enemy of our children and their future health.
And if we can prevent one child from even touching an e-cigarette, that is a success.
As a group, we made an impact, right? And I think that's the big take home from this, is that we didn't go out seeking publicity, we went out seeking the better health of our children.
Our children don't deserve to be hurt by something that they didn't understand. And I feel that the vulnerable population, unfortunately, will suffer the most. So we have to protect our children.